So today's topic is health problems of India and Rajasthan. As we all know, India is a culturally rich country. It has diverse cultures and it has many health problems. Certain health problems, they have been tackled very in a very good manner in other countries, but certain health problems, they are still there in India. So these health problems, they are an obstacle to the development of country. Can you give me any example of health problems which India is facing? Yes. तो मेडिकल केयर प्रॉब्लम हो गई है. यस, एट द बैक आप बताओ हेल्थ प्रॉब्लम, एनी वन हेल्थ प्रॉब्लम ऑफ आवर कंट्री. ओके, तो डायबिटीज एक हेल्थ प्रॉब्लम होगी. पीछे आप बताओ, ये लास्ट स्टूडेंट, लास्ट रूम. ओके, बट कोई एग्जाम्पल आप बता सकते हैं हेल्थ प्रॉब्लम का? क्या एग्जाम्पल हो सकता है? ओके, डेंगू, मलेरिया. सिट डाउन. So the health problems, they can be categorized into certain groups. Communicable disease problems. What are communicable diseases? Which are transmitted from one person to another. Like कौन से होते हैं communicable diseases? Yes, influenza हो गया और chicken pox और कुछ जो बहुत लार्ज स्केल पे इंडिया प्रॉब्लम फेस कर रहा है. कौन सा कम्युनिकेबल डिजीज है? कोविड-19. उससे पहले जब कोविड-19 नहीं था तो कोई ऐसा डिजीज था? स्वाइन फ्लू. HIV कैसा डिजीज है? कम्युनिकेबल और नॉन कम्युनिकेबल? Yes, so there was an explosion of HIV cases in India, but it has been brought into control at a certain level due to health programs run by Government of India. Stop talking. क्या डिस्कस कर रहे हो? So next is nutrition problem. Nutrition problem मेनली कौन से एरियाज में देखने को मिलेगी इंडिया के? अर्बन या फिर रूरल? There are various nutritional problems. Certain nutritional problems are due to overeating, कैलोरी का ओवर इनटेक की वजह से, like obesity, which is seen in urban areas. But rural areas में आपको जो nutritional problems मिलेंगी, like malnutrition, anemia, especially in females and adolescent girls. और क्या nutritional problems हो सकती है? पीछे आप बताओ कॉर्नर में, लास्ट रो कॉर्नर स्टूडेंट. अनेमिया हो गया, मेल न्यूट्रिशन, ओबेसिटी हो गई. कोई भी न्यूट्रिशन प्रॉब्लम? क्वाशियोकर, इट्स अ टाइप ऑफ protein energy malnutrition. Sit down. Environmental sanitation problems. Certain health problems, they are due to insanitary environment or unclean environment. जैसे कि अगर वाटर कलेक्शन है हाउसेस के आसपास, तो देर इज ब्रीडिंग ऑफ मॉस्किटोज. इट विल लेड टू डिजीजेस लाइक मलेरिया, डेंगू, मॉस्किटो बॉर्न डिजीजेस. So there are certain diseases which are transmitted by fecal-oral route or due to unclean water, like cholera, typhoid. All these are due to environmental unclean environment. Then medical care problems, hard to reach areas हैं, tribal areas हैं या hilly areas हैं या कुछ ऐसे remote places हैं, वहाँ पे medical care health services उनकी रीच से काफ़ी बाहर है। तो मेडिकल केयर प्रॉब्लम इंडिया में इसलिए क्योंकि 70% of the population it lives in rural areas. Then population problem, because India is facing population explosion. So due to increase in population, there are various problems like unemployment, crime के increased cases होंगे, etc. So population control is a big challenge for India. So we take all these problems one by one. Communicable diseases, they are a major problem in India. तो क्यों कंट्रोल नहीं हो पा रही है प्रॉब्लम? क्योंकि एक तो ओवर क्राउडिंग की प्रॉब्लम है, पॉपुलेशन बहुत ज़्यादा है, ओवर क्राउडिंग है, तो जो कम्युनिकेबल डिजीजेस हैं दे आर easily transmitted from one person to another. So there are various diseases, examples of communicable diseases. These are the major diseases which India is facing: malaria, tuberculosis, diarrheal diseases, especially in under 5 children, ARI, that is acute respiratory infection, leprosy, filaria, AIDS, and others. So what is filaria? You know what is filaria? Filariasis, which is transmitted by Culex mosquito. तो इसमें क्या होता है, क्लिनिकली कैसे आता है पेशेंट फाइलेरियासिस का? यस, lymph node swollen हो जाती है और जो lymphatic vessels हैं they get blocked, and due to which fluid collection हो जाता है और especially lower limbs की swelling हो जाती है. It is also known as elephantiasis. Leprosy you all know, caused by Mycobacterium leprae, जिसमें deformities हो जाती है extremities की. ARI is acute respiratory infection, influenza, etc. तो मलेरिया इट इज़ अ मेजर हेल्थ प्रॉब्लम ऑफ इंडिया. कौन सा सीजन है जिसमें मलेरिया पीक पे होता है? रेनी सीजन. बिकॉज इन रेनी सीजन देर इज कलेक्शन ऑफ वाटर विच इज it provides breeding site for mosquitoes, and the malaria cases they are at peak in this season. So how this disease can be controlled? Especially by community participation. अगर community participate करेगी अपने घरों के आसपास, पानी नहीं कलेक्ट होने देगी, या फिर घरों के अंदर भी इवन, which is a major factor for breeding of Aedes mosquito. जो वाटर पॉट्स के अंदर, कूलर्स के अंदर आर्टिफिशियल कलेक्शन ऑफ वाटर है, if it is the collection of water is not allowed or the water is changed after 1 week, then it is a discouraging factor for breeding of mosquitoes. So the states in which malaria cases they are found are northeastern states, Madhya Pradesh, Chhattisgarh, Jharkhand, Odisha, Andhra Pradesh, Maharashtra. So most of the cases they are found in these states. इसके अलावा भी दूसरे states में होते हैं, but these are the states जिनमें सबसे ज़्यादा cases मिलते हैं मलेरिया के. The next is tuberculosis. It is a major public problem, and इसके लिए जो गवर्नमेंट ऑफ इंडिया ने प्रोग्राम लॉन्च किया, दैट इज RNTCP, उसका पुराना नाम है, नाउ इट हैज बीन चेंज टू NTEP, दैट इज नेशनल ट्यूबरकुलोसिस एलिमिनेशन प्रोग्राम. And there is also another major problem associated with TB patients. They are at greater risk, higher risk for HIV, because उनमें immunity is already low, so they are at risk of having HIV. The next is diarrheal diseases. It is one of the major cause of mortality and morbidity. Mortality, it is related to number of deaths, and morbidity, what is morbidity? It is related to disease. So these are the two terms जो community medicine में बार बार आएंगे, mortality and morbidity. Mortality it is related to death, and morbidity it is related to disease. So diarrheal diseases, they are major cause of mortality and morbidity in under 5 years of age. So what happens in diarrheal diseases? It leads to dehydration, and because of dehydration, अगर severe dehydration में चला जाता है, especially children, so it may even lead to death. So it is important to rehydrate the patient as soon as possible. Outbreaks of diarrheal diseases continue to occur in India because there are poor environmental conditions. Clean water नहीं है, environmental conditions clean नहीं है, so diarrheal diseases कंट्रोल में नहीं हो पाते और अंडर 5 चिल्ड्रन में इट इज अ मेजर कॉज ऑफ डेथ. Acute respiratory disease, again it is one of the major cause of morbidity and mortality in under 5 age group. And coming to leprosy, now the prevalence rate of leprosy has dropped because of the program which is launched by Government of India, National Leprosy Control Program. तो अब ये जो लेप्रेसी के केसेस हैं वो बहुत ही कम हो गए हैं एंड दिस डिजीज इट इज ऑन द वर्ज ऑफ एलिमिनेशन. फाइलेरिया केसेस, फाइलेरिया के केसेस कुछ एक स्टेट्स हैं जहाँ पे ये डिजीज एंडेमिक है. नेक्स्ट इज एड्स, and these are the certain other diseases which are major health problem for India, like Kala Azar, meningitis, viral hepatitis, Japanese encephalitis, dengue, enteric fever, and helminthic infection. So these are the various communicable disease problems. So these diseases, they can be easily brought under control. इनकी वजह से जो mortality और morbidity होती है वो बहुत ही कम हो सकती है अगर environmental cleanliness, safe water या जो भी resources हैं उनकी minimum input से इन diseases को easily control किया जा सकता है. Most of the developed countries of the world have overcome many of these problems by such measures. So in India also, these diseases can be controlled by manipulation of environment, by practice of preventive medicine, and by improving the standard of living. So these are certain measures जिनको follow करके these communicable diseases can be prevented. These are good site planning, provision of basic clinical services, provision of appropriate shelter, clean water supply, sanitation, mass vaccination against specific diseases like diarrhea के लिए अभी रोटा वायरस वैक्सीन गवर्नमेंट ऑफ इंडिया ने नेशनल इम्यूनाइजेशन शेड्यूल में ऐड किया है. तो रोटा वायरस इट इज वन ऑफ द कॉमन कॉज ऑफ डायरिया अमंग चिल्ड्रन. So this vaccine has been introduced, rotavirus vaccine. Regular and sufficient food supply and control of vectors, especially mosquitoes. Now coming to next, that is non-communicable diseases. So can you give me some examples of NCD? Cancer. Any other? Yes, diabetes. Yes, hypertension. तो इसका दूसरा नाम है NCD का lifestyle disease. What do you think? Why NCDs are also known as lifestyle diseases? Last row में corner में student, yes, yes, stand up. पीछे पीछे last row corner student. What do you think? Why NCDs are also known as lifestyle diseases? Is there any connection between lifestyle and NCDs? लाइफस्टाइल से कोई डिजीज हो सकता है? किसी एक पर्सन की ऐसी लाइफस्टाइल है कि उसे डिजीज हो गया उस वजह से. कैन यू गिव एनी एग्जांपल? कैसी लाइफस्टाइल हो सकती है कि हाइपरटेंशन हो जाए? है कोई ऐसी लाइफस्टाइल के कुछ एक ऐसे फैक्टर्स या कुछ बिहेवियरल फैक्टर्स हैं जिससे पर्सन इज एक्सपोज टू द रिस्क ऑफ हाइपरटेंशन? स्पीक लाउडली. Hectic schedule, that is the person is exposed to excessive stress, हमेशा stressful environment में रहता है. Sit down. So NCDs like diabetes mellitus, CVDs, cancer, stroke, chronic lung diseases, they are major health problems, and they are due to an aging population and environmentally driven changes in behavior. So these are the four major categories of NCDs. Cardiovascular diseases, which include hypertension, stroke, then diabetes. It is due to increase in blood sugar levels or deficiency of hormone insulin. Chronic respiratory diseases, and fourth is cancer. So which is the most common cancer among females and among males? मेल्स भी बहुत सारे आंसर्स आ गए. कंफर्म करके और याद करना, क्योंकि ये बहुत कॉमन क्वेश्चन है और ये क्वेश्चन क्लिनिकल तक चलता रहेगा. So the breathing issues in 62% cases, heart problem 40%, stomach trouble in 22% cases, then diabetes 25% and backache 25%. These are the various issues related to non-communicable diseases. So coming to cancer, it is a major public health problem in India, and every year there are about 7 to 9 lakh cases per year, and nowadays it is seen in every age group, from children, adults, to it is not only limited to the older age group, but it is now seen in every age group. Tobacco related cancers, they account for about half of the total cancers among men and 20% among women. So tobacco, it is one of the major cause of cancer in India. Then blindness. About 12 million people in India are blind. So the major cause is cataract, which accounts for about 62.6% of the cases, followed by refractive error, which accounts for 19.7% cases. So what are the various causes of blindness? Cataract or refractive error तो हो गया. इसके अलावा is there any nutritional cause also? Diabetes, okay. Nutritional cause में कोई deficiency होती है जिससे blindness हो सकती है? Yes. Vitamin A deficiency. और क्या signs and symptoms होते हैं? इनिशियली कुछ एक साइंस एंड सिम्टम्स आपको दिखेंगे विच प्रोग्रेस टू ब्लाइंडनेस. एकदम से तो ब्लाइंडनेस नहीं होगी. तो विटामिन ए डेफिशिएंसी के क्या होते हैं साइंस एंड सिम्टम्स? यस, ओके. तो विजन इम्पेयरमेंट, उसके अलावा बर्निंग ऑफ आईज, कुछ और आईज में कुछ और ऐसे कुछ स्पेसिफिक फीचर्स दिखते हैं? बिटॉट स्पॉट पढ़ा है. देन नाइट ब्लाइंडनेस, केरेटोमलेशिया, all these are xerophthalmia, all these are manifestations of vitamin A deficiency. If they progress to further complication, it may lead to blindness. Oral health care, it is also one of the problems in our country. So there are certain risk factors which may be grouped into various groups. So if we talk about environmental risk factors, they include globalization, urbanization, poverty, low education, and stress. Then behavioral risk factors, which can be modified by the individual, that is lifestyle changes अगर वो person कर ले, then he or she may be at lesser risk of non-communicable diseases. So the behavioral risk factors, they include tobacco use, unhealthy diet, and physical inactivity. What do you mean by unhealthy diet? Yes, balanced diet is okay. What do you mean by that? Yes, fats are in excess and vitamins are in lesser amount. Fibers especially, they are in lesser amount. There is a term junk food. Junk food is unhealthy food, and the diet which is rich in fibers, rich in vitamins and minerals, and less of the saturated fats. You cannot say fat, but saturated fats उसमें कम होने चाहिए, because there are certain fats which are beneficial also. Like कौन से fats होते हैं जो beneficial होते हैं? Omega 3, then PUFA, polyunsaturated fatty acids, they are beneficial, and saturated fats, they should be taken in lesser amount. Then coming to biological risk factors. Biological risk factors are those which are related to the genetic, or you can say कि hereditary factors से related होते हैं, like high blood glucose, high blood pressure, abnormal serum lipids, high waist hip ratio, and abnormal lung function. In chronic non-communicable diseases like heart disease, stroke, cancer, and chronic lung disease. So all these risk factors, if they are not controlled, they eventually lead to death of an individual. So there are 9 targets which have to be achieved by 2025. So I read for you one by one. First target is establish 80% availability of affordable technology and medicines to treat NCDs. Ensure that 50% of people receive preventive therapy for heart attacks and strokes. Next is halt the rise in diabetes and obesity. 30% reduction in salt intake. 10% reduction in harmful use of alcohol. 25% reduction in premature death of people aged 30 to 70 from cardiovascular diseases, cancer, diabetes, or chronic respiratory diseases. 10% reduction in prevalence of insufficient physical activity. 30% reduction in tobacco use, and 25% reduction in prevalence of high blood pressure. So all these 9 targets, the aim is to achieve by 2025. Then after NCDs, coming to nutritional problems. So in India, there are 2 diverse groups related to nutrition. One group which is well fed, and another group which is undernourished group. So in high income groups, diseases like obesity are seen due to overeating and high calorie intake, and there is another group where there are undernourished people. It is due to less intake of calories or deficiency of certain nutrients. So nutritional problem or malnutrition, it is a condition of improper or inadequate food intake or inadequate absorption of food, and it manifests in so many diseases. So these are the various types of nutritional problems. PEM, what is PEM? Protein energy malnutrition, which includes kwashiorkor and marasmus. Nutritional anemia. Anemia is HB levels are low than normal, and if it is due to inadequate diet, then it is nutritional anemia. LBW is low birth weight babies, xerophthalmia, IDD, iodine deficiency disorder, and others. Then after nutritional problem, next problem which India is facing is environmental sanitation problem. So there are various factors associated with this problem or responsible for this problem. There is lack of safe water in many areas of the country, and there are also problems associated with excreta disposal and sewage disposal, which led to environmental insanitation. It is also due to population explosion which India is facing, then urbanization. That is, many people, they are migrating from rural areas to urban areas in search of employment. So there is a problem of urbanization, industrialization. Industries, they are increasing, and it leads to hazards to human health. It is leading to air pollution, water pollution, and also there is disturbance in food chain. Why there is so much disturbance in this row? What is going on? क्या डिस्कस कर रहे हो आप लोग? जब से क्लास स्टार्ट हुई है तब से. What is your roll number? Yes. आपका? आपका नहीं, 2 स्टूडेंट्स के बाद आपका. Why both of you are talking so much? जो पढ़ रहे हैं उनको तो पढ़ने दो आप. So we were talking about urbanization and industrialization, which has led to various problems in environment. Then there are medical health care problems. Financial resources are considered inadequate to furnish the cost of running such a service. The existing hospital-based disease-oriented healthcare model has provided health benefits mainly to the urban elite. But those who are residing in rural areas, certain areas, they are hard to reach areas, hilly areas हैं, कुछ tribal areas हैं, बहुत remote areas हैं. So they are they don't have access to reach up to the health facility. उनको medical care appropriately मिल नहीं पाती है. 80% of the health facilities, they are concentrated in urban areas, and in urban areas also there is uneven distribution of healthcare workers. And we all know in rural areas, about 72% of India's population, it is residing in rural areas. So it is a need to increase health facilities in rural areas. In many villages, they rely on indigenous systems of medicine, like दूसरे और कौन से systems होते हैं? Ayurvedic system, homeopathic system, कुछ quacks होते हैं. They are there in rural areas. So rural people, they rely more on these other systems of medicine. So thus the major healthcare problem in India is inequitable distribution of available health resources between urban and rural areas. Then population problem, because India is facing population explosion. So the government has set a goal to reach a goal of 1% population growth rate by the year 2000. इसका गोल था इंडिया गवर्नमेंट ऑफ इंडिया का, बट इट वाज नॉट अचीव. अभी जो ग्रोथ रेट है हमारी कंट्री की, इट इज 1.8%, एंड इट इज 2-child family norm. The population size and structure represent the most important single factor in health and manpower planning in India today, where the law of diminishing returns, among other factors, and play an important role in economic development of the country. So these were the various major health problems of India. If we talk about Rajasthan, यही health problems राजस्थान में भी हैं, but there are certain problems which are much more concentrated in this state, like malnutrition, anemia, and diarrheal disease. So malnutrition, it is among children under 5 years of age. It is mostly seen in children under 5 years of age. Anemia, it is seen among children, adolescent girls, and women of reproductive age group. And diarrheal diseases again in children under 5 years of age. There are certain group of states in India which are जो रेट्स और दूसरी जो कैलकुलेट स्टैटिस्टिक्स जब किसी भी कंट्री की कैलकुलेट होती है उसमें हर एक स्टेट की रैंकिंग होती है. तो दीज स्टेट्स दे आर एट अ कंपैरेटिवली दे आर लैकिंग and this group is known as BIMARU, Bimaru state. So these are the 8 states: Bihar, Jharkhand, Uttar Pradesh, Uttarakhand, Madhya Pradesh, Chhattisgarh, Orissa, and Rajasthan. So it is a group of 8 states. So these 8 states, they constitute 46% of the total population of India, and 59% of India's poor people, they are in these states. So about 55% of the live births of India are in these states. 2/3 of infant deaths, that is 66% infant deaths in states में होती है. And maternal deaths में से 8 out of 10 maternal deaths, that is 80% maternal deaths in states में होती है. And Rajasthan belongs to this group of states. So it is considered as a high focus state under National Rural Health Mission. So there is, because of the efforts of Government of India through this program, National Rural Health Mission, there is decline in total fertility rate. Number of live births जितनी होती हैं वो अब कम होने लगी है because of the efforts under this program. There is increase in contraceptive prevalence rate under family planning program. जो contraceptives use किए जा रहे हैं अब वो उसकी prevalence rate अब ज़्यादा हो गई है. It has led to control in population, decrease in infant deaths, and improvement in the maternal mortality rate. That is, maternal deaths कम हो गई हैं पहले से. There is improvement like declining in sex ratio at birth, child sex ratio, infant and maternal mortality, but still they are at high levels. So what Government of India is doing to improve all these parameters? Efforts are being made under this program, National Rural Health Mission, to increase the use of family planning methods, to reduce unwanted pregnancies, to reduce the risk of pregnancy and childbirth related maternal deaths, and increase in safe as well as institutional delivery. So what should be done? There is need to focus on health indicators, especially of child, infant and maternal mortality in the state, which will accelerate progress towards achievement of 5-year plan goals, Millennium Development Goals, that is MDGs, and the population and health status in the state. So there is need to concentrate on certain areas like tribal areas and scattered population. There is need of interdepartmental coordination, involvement in planning, implementation and monitoring process. The health indicators, they need to be focused upon, especially the indicators which are for child, infant and maternal mortality in the state, and it will accelerate the progress towards achievement of goals like Millennium Development Goals in the state. So these were the various health problems of Rajasthan and India. Any questions?